As we're coming into the fall with back to school and flu season ahead of us and the rising incidence of COVID infections, please tell us about RSV infection, how it's transmitted, and how it may present, and most importantly, how clinicians will have to make the diagnosis.
Thanks so much, Dr. Rizzo. I completely agree. This is a very timely lung cast because RSV is already on the rise this fall. So like many respiratory viruses, it is transmitted on droplets that travel through the air. It can also be transmitted through direct contact and through fomites or virus particles that can be on objects like pacifiers or countertops. It is highly transmissible, but fortunately, for the vast majority of people, it causes a mild cold or an upper respiratory infection. However, it's also really common in young children, and as you mentioned, it is the most common cause for hospitalization of young children. Almost all kids have had RSV by the time they are 3 years old, and it also occurs regularly in adults. In certain population, particularly infants under 12 months and older adults and people who are immunocompromised, it can cause a more severe lower respiratory tract infection. In these cases, it can present as a viral pneumonia. It can rapidly progress to hypoxia and death. And unfortunately, in hospitalized infants in particular, it's associated with apnea or a cessation of breathing and can cause long-term pulmonary sequelae. So it does have a lot of potential long-term consequences, although for most people, it's quote unquote, just a cold. Testing usually begins with a nasal swab in grown-ups or a wash in infants. There are really outstanding PCR-based or nucleic acid amplification-based tests that can give you a result as quickly as 3 hours. And sometimes those are combined with tests for other respiratory pathogens. Here locally, I know we have one that's RSV, influenza, and COVID. There are also rapid antigen tests, some of which are actually available over the counter. Those take under 30 minutes. They're a little bit less sensitive than the PCR tests, particularly for adults, but perform relatively well in children and can be a helpful diagnostic pathway.
Great. We've already mentioned those two other viruses I was going to bring into the picture. We've seen that seasonal respiratory viruses can cause a perfect storm, as was seen last year with the Triple-Demic or Triple-Demic that it was called in 2022 with COVID, influenza, and RSV impacting our patients and the healthcare system all at the same time. What's your impression of the likelihood of this occurring again this year, or is it already something that's starting to occur?
So there's the famous quote, it's difficult to make predictions, particularly about the future. That's been attributed to everybody from Niels Bohr, the Nobel Prize-winning quantum physicist, to Yogi Berra. So it is very hard to predict. And if anything has very much humbled infectious diseases doctors, it's trying to predict what's happening with respiratory pathogens these days. But if we learned anything from last year, which as you mentioned was the triple-demic season, winter 2022-2023 was battling simultaneous surges of RSV, influenza, and COVID, particularly in pediatric populations, is that this can happen and it's a real challenge in terms of morbidity and mortality for our patients, but also in terms of extreme stress on our hospital systems. So last year's season was a little bit of an anomaly in that it was impacted by the fact that many of the infants and toddlers didn't have pre-existing immunity to RSV because of the very important non-pharmaceutical interventions of 2020 and 2021 that kept everybody from having COVID all at once. So we won't be facing that same challenge, but in the current context, it's really hard to predict what the RSV season is going to look like and how it will intersect with COVID and with flu. The CDC, Centers for Disease Control and Prevention, just released a statement literally this week that they are worried about a repeat triple epidemic. And current data suggests that, at least in Texas, both flu and RSV are on the rise. I saw my first case of the season of an inpatient adult hospitalized with RSV lower respiratory tract infection just a few weeks ago here at University Hospital. So we definitely need to be vigilant. There are other interesting things that we might be able to use in addition to sort of watching the trackers. There was an article published September 15th in Morbidity and Mortality Weekly Report on wastewater surveillance data. So they demonstrate quite clearly that wastewater surveillance data, both for flu and for RSV, can predict, is it a leading predictor earlier than emergency department visits. So we may also have increased diagnostic or sort of predictive technology to figure out when we really need to worry about these triple epidemics.
So better awareness and better preparation sound like the key messages here. So thanks for that perspective.